When I finished medical school almost 3 decades ago, we never used to prescribe testosterone because we were worried it was going to do a whole host of terrible things. It was going to increase your risk of prostate cancer. It was going to cause heart disease. We were worried it would change your mood and make you into a tiger. The truth is now, after 3 decades of research, we know those are really not true. The risks of testosterone largely are very, very small, and particularly if you see your doctor and they measure your levels, really almost insignificant for most people. But it can increase your prostate growth, and so your doctor will measure your prostate-specific antigen, which is a blood test to make sure you're not at risk for prostate cancer. They'll measure your red blood cell level because it does increase the amount of red blood cells you make, and that can be monitored. And if it does go up on testosterone, again, we can adjust the dose or give you a different formulation of testosterone. But generally, very well tolerated, very safe, but like all medications, it needs to be monitored.
There are several risks with testosterone therapy. One is that patients should be monitored for their hematocrit, their blood count. If the blood count gets too thick, we ask them to either donate blood or decrease the testosterone dosage. You should also realize that testosterone serves as a natural contraceptive. If you are trying to conceive or have a child, you should not take testosterone because it will shut the sperm count down. There's been some controversy with testosterone and cardiovascular risk. Currently, there's a large clinical trial, 6,000 patients, looking at testosterone and cardiovascular risk, and that testosterone trial should be released in 2023.
Actually, testosterone therapy is quite safe therapy if it's given to the right patient, to the right indication, and it should be done under medical monitoring. The main problem is when people misuse testosterone, and there are people who use anabolic steroids. They become very dependent. It could have impact on fertility, but also on the cardiac condition and cause cardiac failure. And in that cases, you need to really monitor. So I will never advise someone to take testosterone without the right diagnosis of low testosterone and medical monitoring.